Hi guys, we're Group 2 and we're going to discuss a study entitled A Double-Blind Placebo-Controlled Evaluation of the Acute Effects of the Sildenafil Citrate, which is VIAGRA, on the visual function in subjects with early-stage age-related macular degeneration. But before we start, let us define what are placebo, sildenafil, citrate, and macular degeneration.
To start with, according to WebMD, a placebo is a lookalike of a drug to be tested to help researchers analyze whether the drug has any actual effects.
Moving on, according to Sildenafil, the sildenafil citrate, or what we call VIAGRA, is used to treat erectile dysfunction among men.
Lastly, based on what is Macular Degeneration 2022, age-related macular degeneration is a condition commonly affecting older people that affects one's central vision due to the damage to the retina's macula. With that being said, the introduction of the study showed different aspects. It explained the cyclic guanosine monophosphate (CGMP), a dependent phosphodiesterase type 6 PDE6, is present in high concentration in rod and cone cells and functions as a key role in retinal light signal phototransduction, in which, when PDE6 is activated, it hydrolyzes CGMP, which will cause a reduction in CGMP concentration located in the outer segments of cones and rods. Moreover, the reduction will cause a sequential closure of sodium channels, which will result in the hyperpolarization of photoreceptors, the propagation of visual signals to photosynaptic cells, and the release of neurotransmitters. Sildenafil citrate VIAGRA is used to treat erectile dysfunction by inhibiting CGMP-dependent PDE5 in the corpus cavernosum smooth muscles. It also inhibits PDE6, which reflects an affinity for PDE6, which is 1/10 of PDE5, in which these are the factors which were used to evaluate the sildenafil citrate effect and the visual effects secondary to PDE6. Based on the documentation of the study, during phase 2 of the double-blind placebo-controlled studies, healthy male volunteers with erectile dysfunction, in which there were no changes in visual activity, contrast sensitivity, photostress test, and intraocular pressure, but minimal changes were observed in the electroretinograms, ERG, were observed from the intake of sildenafil citrate, thus doses which ranges from 50 to 200 milligrams compared to the placebo. 3% of the patients who received 50 milligrams and 11% of took 100 milligrams of sildenafil reported mild occurrences of a transient blue-tinged vision and increased sensitivity to lights. Evaluation of the 100 milligram sildenafil effect on the ERG parameters on the patients and volunteers found that there is a reversible transient decrease in the B wave and A wave amplitudes, and a delay in the scoptic time which were not considered significant. With that being said, the study would like to assess to what degree of a single oral 100 milligrams of sildenafil citrate affects the visual function in patients and volunteers with early stage of AMD.
This research was accomplished through a randomized double-blind placebo clinical trial done on 9 elder men with early-stage AMD. A double-blind placebo clinical trial means that neither the patient nor the administrator knows whether the patient was given an actual sildenafil citrate or a placebo. First part of this clinical trial would be the medication. Patients have a randomized chance of being given either 100 grams of sildenafil citrate or a placebo, and then after a washout period of at least 7 days, they are then crossed over. So after medication, there are 6 visual functions tested to see whether the patients experienced changes with their vision or not. And these are the Amsler grade test, visual acuity test, T15 test, photostress test, traffic light tests, and finally the Humphrey perimetry test. There was, of course, their responses was recorded and analyzed whether they performed better or worse, or if there were no changes with their vision in comparison to their other results. Then a pharmacokinetic analysis was also performed by taking their blood sample, and finally the statistical analysis is using ANOVA with 95% confidence interval using a two-tailed test and a p-value of less than 0.05.
Moving on to the results of the research, sildenafil showed no pattern of errors in any visual function test after its application when compared to placebo. The researchers also subjected the results in statistical analysis, which resulted in no significant changes from baseline in the series of tests that were conducted. Additionally, the results of the traffic light test resulted in no significant changes. Adverse events after the application of sildenafil were mild to moderate headache, flushing, and rhinitis. Proceeding to the discussion, the researchers state that sildenafil exerts a minor inhibitory effect on PDE6, which was accounted for from the infrequent occurrence of visual effects observed in flexible dose control of sildenafil in men with erectile dysfunction. There were also no patterns of errors observed in any visual test as a function of time after dosing with sildenafil, nor a consistent pattern of errors within one subject. The research was consistent with various researchers. There's a little evidence of a trend toward an increase in visual adverse events during treatment of sildenafil. As reported earlier, there were no clinical significant changes from baseline in tests conducted. The research was in line with research that also states that there are no significant changes from the same tests conducted. The research also discussed that there were no significant changes in acute vision after single dose of sildenafil in men with early-stage AMD.
With that being said, the study concluded that a single 100 milligram dose of sildenafil was well tolerated and produced no acute visual effects or exacerbation of pre-existing visual impairment in 9 men with early-stage age-related macular degeneration. Alright, we hope you guys learned something from sildenafil citrate VIAGRA and how it is connected to visual functions. And with that, on behalf of Group 2, we would like to thank you for listening.